Also, issue with the mosquito is that mosquito feed on certain people more than others. They like some more blood better than others. They have their favorites also. So there are these issues that plays very important role in measuring these, estimating these contact rates. Okay. So there are lots of complexity that involves this thing. The modeling is about how do you model these terms. That's it about modeling. Writing compartments, writing equations is not difficult. How do you choose these terms are the most skills that it requires. So these are is a bookkeeping exercise. Basically, this is minus. That means people going out of it due to interaction of I and S. They are leaking. The susceptible people are changing. ds by dt is rate of change, right? And di by dt is rate of change for I. dr by dt is R means recovered. People who were having infection before but not having infection now. Have you guys seen this model before this type? How many have not seen it? Never seen this type of model, SIR. Everyone has seen it. Everyone has seen it. Yep. Okay, good. So then I can go very quickly. So then basically if you plot this thing, you get this outbreak. This is an outbreak, right? And this is what, is this model good for COVID? No? Why not? He's saying no. So why? Why this model is not good for it?
They can go back to brain.
So I think you guys are going way deep into the things. But what I'm saying, you know, if you see the number of cases in a town, it is going like this. And this model is only doing one peak, right? So this model is good only for one peak, but not for everything, right? So answer is correct. I mean, there could be many epidemiological reasoning that could cause these fluctuations to happen. Okay. So this model is you need that, but this is not sufficient. You have to add more terms. Remember in this previous slide, you added these terms. So these are, so there could be other reasons why people can come from other areas. Reproduction number is a tipping point of the infection. Yesterday we discussed about it. It's basically the ratio of, so we are capturing, this I is important, number of count of infection. How many coming in and how many going out. This ratio is called as reproduction number. Right? So this is a bucket. This is a bucket. A tap is filling in and tap is leaking out. So how many infections are there depends on this ratio. If it is equal to 1, if it is less than 1, the disease dies out. If it is greater than 1, this ratio is greater than 1, that means one infected person is replacing more than one, him or herself, right? Then there will be an outbreak, and that's what it means here. So there is an outbreak. If R0 is greater than 1, this is peak, and if it is R0, it decreases, goes to 0. So this is a tipping point. The tipping point is R0 equal to 1. And what is R0? Is the ratio of what is coming in and ratio divided by what is going out. Right? I mean, if you have some box here, something is coming in and something is leaking out. So how many is there? Depends on what is how much is ratio of this versus this. And that's what it is. Why is it important? It is important not because only it is a tipping point, but it also gives the features of various things. For example, if R0 is 10, very high number, then you will get a peak, faster peak, very quickly peak, and then slowly going up. Whereas if R0 is small, number of peaks slows down. I mean, it occurs slower peak and on the right. two features. Which one is better? Which one is better? The fourth one, R not equal to 2. Why is it better? Why is it better?
It gives time for the agencies to get the interventions.
Yeah, not answer from you. You are talking in different language. My question is, why it is better for you to have a smaller R naught than the bigger R naught?
The infection rate is lesser. This is easily controlled. As I said, we can give a treatment better, the better way.
But this is not about treatment, because this is not, it is at the population level.
The number of infections are also less.
It will become controlled.
Right. The number of infections low. So one thing to note is, I think he mentioned this thing in the first sentence what you saw. One of the important thing here is, you have limited resources, limited number of hospitals. There are limited number of beds. If there are 100 beds and you get 1,000 infected cases, what will you do? People will have to die outside the hospital, right? And that is the main important point of the disease model. It helps you. So this one is better. Why? Because first of all, on a single day, the highest number of people, this peak, is lower than the number of people. So on a single day, if you go vertically up, the peak is smaller for this number, R0, right? So that means the maximum number of people on a given day will be about this. So this is lower. So any number of resources can handle it, if your resources are within that boundary. But if your number of beds are around this level, then this number you will have more infected people, right? Does that make sense? So the capacity, not only that, also what this reproduction number is doing is it's shifting to the right. It's slowing down the epidemic. You will still have the cases, you will still have the infection in the community, but it is slowing down, it is letting you handle the situation better of the number of cases, right? That is the benefit of these models. It tells you what a R0 is, and it can let you tell how could you reduce the R0 by different interventions. If you reduce the R0, you will shift the epidemics, you slow down the epidemic. And that way you can handle with the limited resources that you have. Limited number of hospitals, limited number of physicians, limited number of nurses, limited number of machines, medical machines, you can handle with that. Otherwise, if all the cases occurs in the same day, you cannot handle. Why you don't have a huge amount of hospital? Because resources are limited. You keep just bare minimum to handle the situations of day-to-day cases, which is normal. But if it is an outbreak, lot of cases, then things get overwhelmed. So that's the benefit of reproduction number. Okay. There's a word we use is mechanisms. 11:15 is the break, right? Or what time is the break?
11:15.
11:15. I think it's a long time. So, mechanism. What is mechanism? Mechanisms. So, for example, if this is a transmission rate from S to I, people are getting infected from S to I. What is the mechanism means here? How things are transmitted. Is all disease are modeled in the same way as transmission for the transmission rate? The answer is no. Malaria is modeled in a different way versus flu is modeled in a different way from a transmission rate perspective. It's different. So there is a way to model like beta times S. There is no I in it. There is no number of I. Only beta S. This is called initial exponential I. This is good. This type of modeling is good for transmission rate. It is good for diseases in the initial stage when the disease is increasing exponentially. This is good. This mechanism will not work if the disease is stabilizing and you have reached to the stable state, right? because disease never always keep on rising. At some point of time it starts to saturate. So if it has reached there, this type of infection is better, transmission rate is better. And if there is a population behaviors are involved, then this type of infection is better. This is called as a mechanism building. This type of process of choosing a right time type of terms is called mechanism building. We are building a mechanism in this how the disease is spread. So there is a word we use called dynamics. All are mathematicians. What does dynamics means? Who can explain me what is dynamics? Are you sure? Are you sure about that? It is more than that. It's not only time. There is a word we use in statistics called as time series that changes in time. Why didn't they call it as a dynamics there? You get I counter your statement. I'm giving a counter example. I'm giving an example that in a time series models, they don't call it as dynamics series. They call it as a time series and it fluctuates like this. Why do they not call it as dynamics then? If it is a time changing.
Its characteristics or features also changes.
Continuous change, evolution.
Well, that happens in the time series.
Population.
No,
But we capture like it is discrete. This is data. That is data. From time mix we also get a image. It is also time series, trajectory. This is time series data like so.
Well, it is.
It is like when a force acts on something and if it changes.
So it is exactly. All of you are saying it right, but it is more to just time change. It is not only time change, but it is a weaving. Weaving one factor influence other factors influence the first one, and that weaving back and forth of the compartments is called as a dynamics. That results in the dynamics. So, for example, you see in each time step, you will compute beta, S and I, right? And that time step will, in fact, will result in people who are change in the count of I. And that count of I will change the recovery rate, right? So it is weaving back and forth different terms. Weaving, do you know what is the word weaving? Have you seen your moms weaving the sweater? Right? It's the same type of idea. Each of the component or mechanisms are impacting the other components, and that is making things dynamic in nature. So, okay, I already talked about it. Reproduction numbers. This is the reproduction numbers. For measles, it is a very high reproduction number. For measles, it is very high reproduction number. For it's around 17. Influenza, it is 2. Chickenpox is 7. So that means measles can spread much faster in the population in general. Have you guys seen a movie called Contagion? Have you seen a movie called Contagion? Or have heard about it? Yes? No? Okay, you should see that. These people are actors and they are talking very technical. People don't know these things, but these actors are have did huge amount of research to talk very in technical way. Kate Winslet, you know Kate Winslet, Titanic? Have you seen the Titanic or have heard about? There was an actress, Kate Winslet is there in this movie. So let's see what is this. There is possibility of the speaker. Possibility of the speaker. So we can put a microphone. Can you hear or no?
What's that?
Can you hear or no? It's not possible. Let's have a let's play it again, and you have to all hear it very. So we should not talk actually, otherwise we'll. Okay.
What's that?
It refers to transmission services. The average person touches their face 2 or 3,000 times a day. 2 or 3,000 times a day. 3 to 5 times every waking hour. In between, we're touching doors, water fountains, elevator buttons, and each other. Those things become phone lines.
This is something we want to release to the press respiratory moment.
And how's the public going to react to that? Hard to say. Nazi trucking movie will keep you from getting in the ocean, but a warning on the side of a pack of cigarettes.
We're going to need to walk this over the fence before we start to freak everybody out. I mean, we can't even tell people right now what they should be afraid of. Tried that with swine flu and all we did is get healthy people scared. It's the biggest shopping weekend of the year. And just these young kids. People that work at stores, government workers, people that work in hospitals. When will you know what it is? What causes it? What cures it? Things to keep people at home.
What we need to determine is this. For every person who gets sick, how many other people will affect? So, for seasonal flu, that's usually about 1. Smallpox, on the other hand, is over 3. Now, before we had vaccine, polio spread at a rate between 4 and 6. Now, we call that number the R naught. R stands for the reproductive rate of the virus.
Any ideas what that might be for this?
How fast it multiplies depends on a variety of factors. The incubation period, how long a person is contagious. Sometimes people can be contagious without even having symptoms. We need to know that too. And we need to know how big the population of people susceptible to the virus might be.
So far, that appears to be everyone with hands, a mouth, and a nose.
Once we know the R naught, we'll be able to get a handle on the scale of the epidemic.
So it's an epidemic now. An epidemic of what?
We send samples to the CDC.
In 72 hours, we'll know what it is. We're lucky.
Clearly, we're not lucky.
Okay. I don't know if you guys can hear, but this is really incredible type of work that this movie talks about. And okay, so once you have this model designed, the next step is to know these estimates of the parameter. That is very, very important. So then the question comes, how do you estimate? So what do we do? What is these dots? Dots are the data that comes from surveillance, from public health departments. And it tells you over time how many cases are occurring. How many number of cases on day 50, for example. Those dots represent each time point, how many cases are there. So your goal of the model is to get the, choose beta and gamma. So basically, in this model, there is 2 parameters, beta and gamma, right? Your goal is to find out what is my beta and gamma that fits that curve to all the data points. Better, best one. So basically, So this is the data, and you are fitting this is a model from I compartment, right? That's what the shape was looking like. And you are trying to fit it. And you are trying to find what is my beta and gamma. Beta is on this axis and gamma on this side. What is my beta and gamma that fits the rate at which this curves fit the most of the data point. That's the goal, and that is what we do most of the time. And it's very complicated task, very complicated task to do something like that. Yogesh, have you done anything on estimation?
Recently, sir, I'm working on the side project and we have done estimation with the help of ABC and SMC.
Okay. And you are using which method?
ABC and SMC.
Okay, so going further, once you have the estimate, now you have to think about what is my disease look like, and disease biology decide which model to use. So first let's look at this, or look at this one first. SEI means exposed class. There are diseases which needs some times before they people get infectious in this. Can you give me an example? What is the disease that can be captured by this model, SEI? Okay, TB could be the one. There are lots of diseases. Flu also. You don't become infectious the day you get pathogens, right? You become infectious after 2-3 days. So flu is also. But is the flu model good for this type of? Why not? Recovered classes is important. There is no recovered class. HIV. Once you are infected for life. So this is the best model for that. Very good. Thank you. Which model is good for, which disease is good for this one? SEI. So what is it? SIRS. What does S means? That means again you become susceptible. What disease is this? COVID-19. Common cold. You can get multiple times. There are many diseases by the way. What about this one? SIS. You have to think about. Okay. But what it is helping us think about different disease lets you choose different boxes and different arrows. And disease characteristics tells you which of these figures to choose. What about this one? This has T as a, I'm using as a treatment class. Right? If your question is about disease trajectory, these models are fine. But if the question is about treatment also, there is a treatment. There are many diseases for which treatments are not there. Right? So you want to model this way. But if there is a treatment available, then you want to, and the research question is about treatment, you want to, you just don't build a compartment without any reasons. Every compartment has to have a reason why you have built it. Okay. What about this disease? Birth and death. Where do you use birth and death and where do you not use birth and death? Give me an example of a disease where you will not use birth and death. What short time? Short time is what? Infectious period or even the infection process. Yes, sir. Right. So,
viral fever. Viral fever.
Yeah, so flu. If you're talking about flu, viral fever is what? Virus has to be influenza virus probably. Or maybe some other type of virus. So that is, you will need birth and death or you will not need? Not need. Why? What is birth and death? How many years a person lives? 60, 70 on an average, at least, right? And what is the incubation, what is the infectious period or what is the life person remain infected in the flu? 10 days as compared to 70 years. 10 days as compared to 70 years. If the duration of infection is very short, you don't put the demography, which is birth and death. If it is long, so where do you put birth and death then? Give me an example of a disease. Tuberculosis, long disease. few years it takes. Well, cancer is not infection. I'm talking about infection. Right? HIV, right? There are many diseases. Malaria. All of these diseases. Well, malaria is depends actually. Depends on what you are modeling in that. Okay. This is a very beautiful way of seeing. This is from some book actually that I got this picture, and what it is showing. If you model as two compartment S and I, the shape of I compartment, it will be looking like this. What is it showing? Saturation. It increases exponentially and then saturates. Shape of I. So box I over time will look like this. If you have S, I and R, recovered compartment, then you will have a peak and dies out. If you have birth and death, then you would fluctuate. Okay, so why is this important? Because it tells me what model to choose. So if I am seeing the actual real life data which is fluctuating, I would not probably choose this model or this model. So it is a backward engineering, looking at the data and then deciding which model to use. Does that make sense? So this is where is also you one need to decide. Not only disease decides what model to use, but also data decide which model to use. Does that make sense? Okay. What is the data sources we are using for that? Well, we are using surveillance data. We are using electronic medical records. I think someone will be talking about electronic medical records in the last day, right? And other is epidemiological studies. These are the, what is surveillance data? What does surveillance data mean? What does surveillance means?
Sir, community medicine based data.
Well, how is it collected? How is it collected, surveillance?
So basically they organize camps and from that they collect patient history and all those things.
Well, that is an epidemiological study. That is epidemiological data because that's a focused small population. But what is surveillance? What is surveillance? And surveillance is ongoing process, never stops. It keep on going. Health department does it.
Like big institutions like ICMR, DBT.
Yeah, so Ministry of Health does it. So there is a Ministry of Health which is central government. Then there is a state government health department, and every state has district, or not, a state has regions. Each region has health departments. Each region has districts. Districts has blocks, and blocks has villages. So there are different categories of health departments that is feeding the data upward. And that is called as a surveillance, and it is an ongoing. It is going on for mortalities, it is going on for infections of different diseases, it is going on collecting all the time. And that is the surveillance data. Now, so what is electronic medical records? Can you explain me very quickly so that everyone can understand?
Yeah, like I'm working in the friends database. Like if there is a system, like there is a platform.
How is it collected? That's what I mean.
Like every hospital has a portal.
Okay. So hospital has a certain way to, when a patient goes there, hospital collects the information.
Yeah.
What does that information includes?
All information like demographic information.
Demographic, birth date, which location the person is coming from, what is the gender, right?
Yeah.
Maybe other things, socioeconomic conditions, something like that. What else?
Purpose of hospital visit.
Purpose of visit. The reason you will visit to the hospital is not for vacation, right? You're visiting hospital for some symptoms, for treatment, right? Some kind of issues there. So those symptoms. What else?
Date of entry, how many days they are stay here, how in which ward.
Correct. What type of treatment, what type of diagnostic a patient has gone through. These all records are saved in the hospital setting, and that is called as electronic health records. What is the difference between health records and medical records? You know?
I think medical records.
So health records contain your socio-economic aspects also. And because health could be impacted by many other factors. Medical record is related to just by medicines related. It could be drug, it could be symptoms, it could be vaccine, all those things. Health could be in more broader scale. Okay. These records are not easy to get because these are privacy concerns. You can't just give the records of someone's health related to just. So it is a lot of difficulty, and you should talk about some. He will be talking about some challenges in getting that data as well. Okay. So those are the data, and epidemiological studies are done by researchers, individual studies. Those are local. There were specific populations for which they are. So these are very different type of studies from which the data is collected. This is an example of a model that is capturing hepatitis C. Have you heard of hepatitis C? Virus? It's a viral disease, right? And hepatitis C, and this is actual published work, the goal of this work was, there's a treatment called as direct acting retrovirals. Retrovirals are the treatment that are given to some virus disease. For HIV also, retrovirals are given. Basically, what it was saying, this is a liver disease. Hepatitis C is a liver disease. Liver stops functioning the way it is supposed to function, right? So there are different stages of liver, and before it fits. So these are stages of the liver: first stage, second stage, third stage, and eventually the liver stops working. So we are capturing this disease in different stages of the liver. I mean, people in number of infected people in each type of liver stage. There are 5 stages of the liver, and after that, liver stops working. Okay, so but what it is capturing is infection process. And why is it has many stages of the liver? There are people in this stage, there are people in this stage, there are people in this stage, and so on. So why there are many stages of the liver that we are putting? Because we were interested in the treatment, expanding the treatment. So typically the treatment, the guideline says the treatment is only given to these 2 set of people, not to all the stages, not to initial stages of the liver. Only at the last 2 stages the treatment is given. That's the guidelines, government guidelines. But now what we were aiming to expand it to the other 2 stages also, the earlier stages. And we wanted to see, is it beneficial to do it, or we are just wasting money, too much money? And it is not improving the outbreak situation of hepatitis C. So that was the part, and we did this work. So this has a dynamic model for the disease, but then it has economic models also. It has an economic models for cost of expanding. So it has economic model, it has a disease model, on top of it is an economic model, and top of it is an intervention model. What type of intervention? So there's 3 layers of different models, and they are feeding back and forth into each other. This is another model on HIV/AIDS, and these are all published papers, by the way. So this model is about HIV. I don't know if you can see. This is having, I can't see it myself. So, yeah, it has a gender. It has a gender into it. It has risk categories. There are some people who are high risk of HIV, like sex workers. There are very high rates of infection among them. So they are high risk. And then there are even truck drivers are also considered very high risk. And then there are enteroretrovirals. Enteroretrovirals are the treatment given to the HIV patients, and they are given to maintain the level of infection in the body. So once the infection goes beyond a certain level, they give a treatment, and it goes on. And once the virus count decreases to certain levels, you stop the treatment. That's the goal, because the treatment has side effects, major side effects. So the goal is to maintain the virus level below. You cannot eliminate the virus. Once the person is infected, you cannot eliminate it. Okay. So then it is maintained for some time, and you stop the treatment because you have to control the side effects also. And so then the virus comes back, and then you give and maintain the infection, give the treatment again, and maintain the level of the count. So this is how it works in HIV patients. Now, what is the problem with HIV patient? Why can't you control the infection? Because it goes in the stem cells, and it goes to the places where you cannot eradicate from. But there is a way to eradicate it, is by usually it is by pre-exposure prophylaxis. It's a type of a vaccine, not a vaccine, but it is given to the patients who are not yet infected. So you take it as a pill every day. And the hope is it is given actually to a high risk group, like sex workers. They take it as a treatment in a high prevalent countries. They take it every day as a pill. Why they take it? Because typically when HIV person gets infected with HIV, there is a short window period in which the treatment if given could cure. So for example, nurses in the hospital settings gets the PrEP. Sometimes by mistake they get the infection into their body by treating a patient. So they get this emergency treatment in a medical settings. But window period is very small, very, very small. If you do not get the treatment within that infection establish itself in the body, and you cannot treat it with enteroretroviral. See how complex it is. So therefore there is a PrEP, pre-exposure prophylaxis, is a treatment given as a tablet every day. But this is, if you give more treatment in the population, what happens? You say, oh, there is a treatment, why don't we give it to everyone? No, you cannot. Why not?
Economic issues. You have to spend a lot of money on it.
Say it again?
You have to spend a lot of money on it.
Okay. Suppose I have infinite amount of money, then?
There will be hysteria among people as well.
They have what?
Hysteria among people.
They will not take it.
Yes.
Is that what you are saying?
Yes.
Behavior issues?
Yes.
Okay. Suppose behavior issue is not an issue, then there is no problem. You should give it to everyone then.
It will have side effects maybe.
Well, side effects are there, but still you will completely wipe out the disease. HIV will not be there anymore in the population if you do that. But why you don't do it? First of all, this will take a long time, even if you do something like that. Second is the drug resistance. Because if you give the treatment, there will be a lot more drug resistance cases. You are putting drug pressure in the population a lot. This is a balance you do it as a public health policy makers. You don't want to give too much drug in the population. What is the problem with the drug resistance? What is the problem? What does drug resistance means? The drug is not working in the patient. Resistance means drug is not working in a patient. That drug is meant for that patient, and that drug is not working. And what is the bad thing about it? Well, it is not working, of course, for that patient. But that patient is just single person. That's okay. But the problem is you have discovered this treatment for last 60 years of research, and you got one pill. And now you spoil that 60 years of research with making the drug as a resistant. Once it becomes resistance, it will spread. Resistance will spread in the population, and it will spoil the treatment for everyone. So you don't give the treatment, you don't give a treatment like that to everyone. So that's the issue with HIV. I mean this drug. So there is a trade-off. Benefit of giving more treatment, but also what is the benefit? You are curing more people. But you maintain that cure rate in such a way that a resistance is not. So modeling is very, very key aspect in this area. Okay, so I think I will stop here. Vaccine this is with Dr. Jayaprakash, who will be talking very soon. Trivedi and anyone else there? No, I think there is the one. Okay. And okay, I think I will stop here. And I think this is fine, and this is a good place to stop. I will be talking about how to analyze a model in the next class, and then in the afternoon we will do some hands-on work. Okay, so let's go and have a session. Is interaction critical? So this is about how do you choose different types of models, and this tree helps you to drive. It's not like every time you choose SIR type model. There are different types of models. So for example, is interaction critical? Interaction means, what does interaction mean? If it is about influence, it is about infection, it is about contacts, then that's an interaction. So answer is yes and no, then you look for other things. So for example, yes, then need to model individuals, whether you want to model individuals or you model basically non-individual. If it is no individual, then you take SIR type model, maybe system dynamics model. If you are individual, then discrete event simulations, micro simulation, agent based model. These are the three types of models, by the way, and so on and so forth. Events, there are certain events that you capture, like treatment is an event, diagnosis is an event. So those type of events, if you are capturing and they are occurring on a regular interval, then you take care of it based on decision tree. How many of you have heard of decision trees? So it is not one size fit all. You know what is one size fit all means? What does one size fit all means? That means I learned disease model, SIR model, and I use that model everywhere. No, it doesn't work like that. You have to look at what is needed in your research question that guides you which model to use. So decision tree is a very simple model. It's a tree, bifurcation. And then there are Markov model is require health states. If there are states also, and if it is not interaction is needed, then you use Markov models, simple Markov models. Have you anyone used Markov models? It's also having a compartment. For oncology, for diabetes, you use Markov models, not infectious disease model, not SIR type models. Why? Because there is no interaction important there, right? The people get the disease due to social factors, due to genetic factors, not by interaction, right? So that's where the Markov model comes in. Individual sampling model is another type of model. So this tree helps you decide what is the model that you will use in your work. These are the most important softwares that I use to do the modeling work. NetLogo. How many of you know about NetLogo? Have anyone used agent-based models in the work? Okay. How did you use it? Which software?
Make.com.
Huh?
AI agent models.
AI agent model. Okay. But these are the already inbuilt packages that you can use, software that you can use to generate models. It's called NetLogo, and there is another software called as AnyLogic. MATLAB, all of you might be aware of MATLAB, right? MATLAB is another. Now Berkeley Madonna is also another software that is very easy. It's a drag and drop. It has circles and you drag it to make a box compartment susceptible. And it has arrows, you drag it, and it has very cool features. So you are not spending time in drawing and writing down the equations. It's saving a lot of time actually. Also, R Studio, R you are using it, right? R Python, yeah, you are using R, okay? Python, yeah, Python, you can use that. C, C++, these are high programming languages that you can use. What is Shiny? Have you heard of Shiny?
It is an integrative app built under R.
Yeah, but why is it used? Why is it used? What is the purpose of Shiny? Anyone? Have you heard of Tableau?
Yes, sir.
Have you heard of Power BI?
Yes, sir.
Okay. These are for visualization, better visualizations of, right? These are specific visualization software. R Shiny is one of the package of the R. R is a programming language that gives features for visualization of your model simulation. Okay, so that is what we use it. So this is a model that is being used by CDC, Center for Disease Control US. Basically, it is mapping the infection of a different type of disease and its curve over time. It is mapping something else. You can enter certain inputs here. So it's a beautiful, easy to work with the models once the model is made. And it is made in one of these softwares like Tableau, Power BI, R Shiny. Python also have something, right, similar to that. Okay, but these are common ones in this. Now AI tools are also coming into pictures, but I don't know which one you people are using nowadays. Okay, so this is this thing. I have few things more, but what I want to do is, let's see. I want to right now talk about this thing, but before we go further, you have seen some examples of the projects in the slides, right? You saw the examples in the previous slides, right? Now you are ready to think about your own group projects. Right, you have better idea, and he was mentioning about few projects in the morning. So where is the sheet? Where is the sheet? I think we were circulating some sheets with the names. We are lost. Where is the sheet gone? It has to be here only. Did you guys pass it back? Yeah. So who was the last one to sign or who did not sign it? Oh, it's in the folder. Okay, everyone signed it in this? Is it there? Okay, we have lost a sheet actually. Is Ashwini have it?
Yes, sir. Yes, sir.
Ashwini have it? Okay. Okay, we'll get it. So we'll take a break after the before we start in the lunch time. After the lunch time, and we will try to take 15 minutes to think about a research project title, and we can discuss in the evening about it. Okay, so now what you have seen so far is how is the model look like. Do you want to now do analysis, mathematical analysis, or you want to look at the simulation of the model? Where is Ashwini right now, Ron? Can you call Ashwini, please? Can you message him? If you want to work, so there's two choices. We can start with some mathematical analysis first, or we can start with some simple simulations. What do you?
Some mathematical analysis.
Say again? Okay, how many in favor of mathematical analysis? Okay, how many in favor of simulations? Only 2, 3. Okay, so I think the simulation mathematical analysis wins. Ashwini, where is the sheet? There was a signing sheet for the project. Do we know where it is? Who has not signed it for the project, group project? But so everyone else signed it, so it came this way then. It traveled this way, right? It traveled this way. Did you all remember to pass it? Right? You went it back. So what happened? You guys signed it and gave it to who? Or you gave it in front and they are saying they sent it back. Oh, sheet is here. Oh, it was. Everyone has his name here in the sheet? Yes? You both don't have it. So, well, you will be mentors for some of these teams. So, I think the project topic should come from you all rather than me assigning it. Okay, so decide on a project topic that interests you. For example, he's talking about